Now, diabetes is the fastest growing health threat facing our nation. Over the last decade, the number of people diagnosed with the condition has doubled, and there are now 4 million of us living with diabetes in the UK. Mark Hancock from Horndean is one of them, and to mark World Diabetes Day, he joins me now. Thank you very much for coming in, Mark. And I must say, you look a picture of health. You don't look like the normal kind of person that we might associate,
Sure.
with the condition. Tell me a bit about how you find out and how that made you feel.
Okay, so I was diagnosed in 2010 as type 2 diabetic, but in reality, really, I probably had been diabetic for a few years before then. I'm a financial advisor, so it meant that I sat a lot of time sat at my desk, eating the wrong things, late nights, eating a baguette as you dash between appointments, that type of thing. And I guess over a period of time, it took its toll on my body. I did put on quite a bit of weight, and I went up to 16 stone. And then I tried to sort out some life cover for myself. And a nurse comes around as part of the process, and they run some tests on you, and they said, well, we think you're glucose +1. And I said, well, has that got something to do with diabetes? Possibly. You need to go and speak to your GP. And of course, they ran some more tests and found out, unfortunately, I was.
And how did that make you feel? Was it something, were you surprised?
I was absolutely shocked. I mean, I'm quite tall anyway, so I tended to carry off the weight a little, and I guess I didn't really know that I'd put the weight on that much, and I think a lot of other people had sort of hadn't really seen, because I had a suit on and it sort of covered up a bit really. I just remember there was a time that I was in the kitchen after I'd been diagnosed, and I was worried about what I could eat. I was opening the cupboards and everything looked so confusing. Everything looked like it would harm me. And I spoke to a friend of mine whose father had been diagnosed, and she said, look, don't worry, things take time, you're going to need to work it through. And I went to go and speak to my GP and speak to my nurse, and they started talking about the types of food I should eat and shouldn't eat, and how I should sort of balance my meal, and some of the things that I should avoid, really.
And you've kind of come to some conclusions. You've done quite a lot of research, and you've taken on a diet that's a kind of low carbohydrate, low blood sugar diet. What's that about, and how's it worked?
Well, a couple of years ago, I heard that there's some research had been done on a group of patients who were suffering from type 2, and they had managed to go through sort of what would seem to be quite an extreme diet, but at the end of an 8-week period, they'd reversed their condition, and they weren't diabetic anymore. And I was quite interested in that. And I went to speak to my doctor and my nurse, and they sort of said, well, it's very restrictive. It's a low-calorie diet. You can't actually cure yourself from diabetes. We don't think you should really go on this sort of thing. There needs to be more research to be done.
But you did anyway?
Well, I didn't actually.
Okay.
I walked away and I thought, okay. And I took a bit of running. I did a bit of running. I did the Great South Run for a few years, that type of thing. But my sugar levels were at a certain level, but they weren't perhaps as low as I would like them to be. Okay. And then I heard Dr Michael Mosley on the Jeremy Vine show on Radio 2, and he explained that yes, you could reverse and diabetes, and there was a lot of research being done, and he had a book out, and I thought, do you know, I'm going to do it. But it is an 800 calorie a day.
800 calories a day?
Absolutely.
That is really low calorie, actually. That's not what I thought.
Well, to be honest,
do it?
All calories aren't the same. So, I use this analogy a lot. If I gave you a big chocolate cake to eat, and you would eat probably, I don't know, a couple of thousand calories, and you would probably feel like you needed something else to eat later in that day. But if you eat the right types of food, then they can have relatively low calorie count, and they can be very good and very satisfying and keep you full for longer. So, to be honest, although it's 800 calories, I never counted calories at all the whole time I was on my diet, because I followed a book. And the book told me what I should have for breakfast, what I should have for lunch, and what I should have for tea. And I followed that, and I started seeing the weight dramatically fall off me.
How much weight?
In the first week, it was 9 pounds.
9 pounds?
Yeah. And then by the end of the diet, it was 22 pounds I'd lost.
Okay.
I'm the lightest I've ever been.
And how do you feel?
fantastic.
Yeah?
Do you know one of the best moments for me was I went shopping because all my clothes started feeling a bit heavy, a bit big rather for me. I had gone up to a size 36 waist jeans. At one point I'd been 38 when I was really at my heaviest. And I thought, do you know what, I think I might be 34 now. So I took some 34s into the changing room and they were just falling off of me, and I had to go back and get size 32, which I don't ever remember being size 32, probably right back to when I was a teenager. And that all happened within 8 weeks. And not only that, my medication stopped after 1 week.
Well, it's an incredible story, Mark. Thank you very much for coming in. I'm afraid we're out of time, but well done.
Thank you.